If I conferred with our furry friends, man to animal, think of the amazing repartee. If I could walk with the animals, talk with the animals, grunt and squeak and squawk with the animals, and they could talk to me.
Hello and welcome to Pet Watch, a monthly program about the Williamson County Animal Center. I'm Debbie Sims and I'll be your host today, and my special guest is Dr. Martha Bennett. Hi Martha.
Hello, good morning.
Martha is from BluePearl Veterinary and Specialty Clinic, and you guys are located in Cool Springs. I've seen your sign before.
Yes.
So what is BluePearl and what do they do?
So BluePearl is a group of specialty and emergency hospitals. We're in 17 states. We've been around since 1996, started out in Florida. The current hospital in Franklin joined the BluePearl team in 2009. We got in our new building in 2014. And we're open 24 hours a day. We have emergency medicine 24/7. We have specialties in dermatology, oncology, surgery, internal medicine, radiology, critical care. They're available mostly during the week, the business hours during the week. Critical care is available 24/7. So.
Wow. So if and mostly cats and dogs. People bring cats and dogs to BluePearl. So you're an emergency center, like a hospital emergency room is for people, but you're for pets.
Yes.
And you, personally, what pets do you have? I like to ask all my guests that. I think you're a horse person.
I have horses and I have a saltwater aquarium. And there's a duck in the barn, but I don't know if that counts.
A duck, okay.
I don't know if she counts as a pet or not. She's just
I guess so. That's an exotic pet.
Kinda.
Maybe, kind of, sort of. I'm sure you have a few barn cats around the property.
I'm interviewing for a barn cat, but haven't gotten one yet.
Interviewing. Okay, we'll keep an eye out at the shelter.
Okay.
That's who would be perfect for your farm. How many horses are there?
I have 6.
Yeah.
Yeah.
And do you do pleasure riding, trail riding?
I play polo.
Okay, you play polo. Wow.
Yeah.
Oh, that's great. Maybe we'll see you one weekend out at one of the weekend polo tournaments in Franklin. They do have. And you went to Auburn, which a lot of our vets that we know around here did go to Auburn. So War Eagles, you know.
War Eagle.
Right. How long have you been with BluePearl?
I've been with BluePearl since 2010.
And what's your specialty there at BluePearl?
So I'm not a specialist. I'm an emergency. I'm an emergency doctor. So I handle the cases that come in that are urgent in nature, or that sometimes we'll use the emergency department as a way to get patients hospitalized that don't necessarily have time, or it's not appropriate for them to wait to see a specialist. They can be admitted through the emergency department. Sometimes their vet will send them over on that basis. But it's mostly the walk-in things, the hit by cars, vomiting, diarrhea.
I was going to say, what are the major things that people bring their dogs and cats to the BluePearl for? Anything
from a torn toenail to hit by car or broken leg or some other serious trauma.
So if an animal is injured and our own veterinary offices are not open, then BluePearl is a great option for people.
Yes.
Especially if animal hit by a car, even though it might seem to get up and walk away, could suffer an injury that's not visible, right?
Right. Usually on those cases like that, the first 24, 48 hours, things can change dramatically. And I mean, if you or I got hit by a car, we wouldn't necessarily go home and eat dinner and go to bed. I mean, they'd be observing us in a hospital overnight. And so anytime you've got a trauma that significant, it makes sense to at least get everything checked out and make sure there's not something just under the surface that you're not seeing. Because, you know, if you or I can't breathe, we can vocalize that. If your dog can't breathe or your cat can't breathe, they're just going to get really quiet, or they may not overtly tell you something's wrong. So sometimes you need a test to figure out exactly what's happening.
And that could indicate an internal injury to the lungs. So
to the lungs, or bleeding in the abdomen. Sometimes head trauma. There's some subtle things that we can pick up on that will tell you that there's swelling in the brain that needs to be taken care of too.
So
ruptured bladders don't always show up immediately either, but that's something that we can check for, but you wouldn't notice it at home for a couple days sometimes.
And that would be from difficulty urinating or not urinating at all.
Not urinating or
okay.
Yeah.
And that sometimes happens due to bladder stones as well, and that becomes an emergency for the animal.
Yeah, cats especially can get, male cats particularly, they can get a urethral obstruction. They can't urinate. They'll go in and out of the litter box. They'll try to pee. They can't. They're crying out. They're super painful, and that's definitely something that needs to be addressed immediately. Injuries to the eyes also, if you scratch the cornea, those are things that need to be handled that night. Those are the things that don't necessarily need to wait until your vet's open the next day.
Right, and just a red eye can really be something serious. It looks like a red eye to you.
Or just a squinty eye.
A squinty eye or swollen eye, anything like that. So you're kind of like the triage doctor in ER when a person goes in and says, I don't feel so good, my chest hurts.
Right.
But except your patient's not talking to you, but they're giving you the other signals that you know, that the owner might not know. And difficulty breathing is sometimes an indication of a pneumonia if a dog is has an advanced infection or something like that.
Yeah, difficulty breathing is always an emergency. It doesn't really matter if you're concerned about the breathing. We need to figure out what's going on there. But difficulty breathing can mean you've got trauma to the chest, like you said, pneumonia, asthma. It can be an allergic issue. There's just a lot of things. Sometimes an airway obstruction can do the same thing. So there's a lot of things that difficulty breathing can end up.
Suppose your pet is acting ill and you have no reason to suspect there's been an injury, an attack, an illness. Is poison or eating a toxin around the house something that everyone should think about?
Oh, absolutely. Absolutely. And there's things that you wouldn't necessarily think are toxic that are. Just because we can eat it safely doesn't mean a dog or a cat can eat it safely. Grapes and raisins are a big example of that.
What about chocolate? You hear a lot about chocolate.
Chocolate's a big deal. It matters how much of the dark chocolate is in it. Like white chocolate has very low concentration of the actual methylxanthines, which are the toxins that are in there. It's theobromine and caffeine, or the
Is it cocoa? We would commonly refer to it as
cocoa, like the cocoa
or
powder. If you see like the real fancy chocolate bars that are like 99% cacao, those are the bad ones. White chocolate has very little of anything in it, and it depends on the dog's size. It depends on how much they ate. And it can cause anything from just a little bit of hyperactivity, vomiting, and diarrhea to tachyarrhythmias, seizures, and coma.
And my friend's dog ate an entire bag of Hershey Kisses with the foil.
Yeah.
So that complicated things. It
does.
Yeah, it ate all the wrappings, so all that had to get through the system too. So
and those can cause blockages as well,
yes,
which can be an issue.
Yeah, and I have another friend whose puppy ate mulch 2 times, and the mulch got lodged in the intestine. So
there's chocolate mulch.
Chocolate mulch. Well, then that just combines both of those.
It does.
So I guess the thing is to prevent these things. There are all kinds of poisons around our house, especially in the garage. When anybody says, "Oh, I put the dog in the garage," I always cringe because there couldn't be a worse place.
No.
Because at least under the sink in the kitchen, maybe they can't open the door, or in a cabinet, but in the garage, there's antifreeze, really poisonous substances sitting around. There's gasoline cans.
Yeah. Insecticides.
I was looking at some of the
fertilizer.
The most common poisons for animals I was surprised to get putting together are human medications and over-the-counter.
Yeah.
So human prescription and over-the-counter like ibuprofen account together for about 35% of all pet poisons.
Some of those are accidental, some of those are intentional. I wouldn't say intentional, but sometimes the dog gets into your purse and gets your pills.
You were just overlooked the fact that
exactly,
it was
or you left them on the nightstand and the dog chews up the bottle.
Yep.
Sometimes it's, oh shoot, my dog's limping, let's give him some naproxen. And then they start Googling and realize that they just gave their dog an overdose of something. And so even though the lameness wasn't that bad, now we've got a second problem. So I find that people tend to Google after they give the medication to see if
good.
You should probably do that.
There's quite a warning on naproxen and ibuprofen both.
Yeah.
So basically, people medication is not intended for dogs.
It's not.
And cats. And unless your veterinarian specifically tells you to give it X, antacid or something like that, and tells you exact dosage, don't go to your medicine cabinet to give your dog.
Exactly.
Yeah.
And sometimes it's appropriate. I mean, we use, there's a lot of drugs that are over the counter that are human drugs that we use, but the dosages are different.
Right. The frequencies are different. The size of the animal matters. The other illnesses the animal might have, just like humans.
Or other drugs that they're on can make a difference too. If their dog's on prednisone for some autoimmune disease or something like that, and then you give them an aspirin on top of it, that can make things a lot worse.
Yeah, and you mentioned insecticides, and there are also, people like to treat their lawns sometimes with, now there's a whole thing, let's spray the yard for ticks. Fine, but are you reading what's on the canister? Are you applying it properly? And are you keeping your animals away from it for as long as they need to be? Yeah. Right? Because some of that can be harmful.
It can be, yeah.
You don't want to spray these things and then let your dog out to use the bathroom or your cat out to roam. Yeah. They could get very sick.
I would definitely follow the instructions, or if you use a company, usually they have precautionary statements for pets on there to tell you what you need to do to keep them safe. Because it's a big deal, and anytime you've got someone coming out treating something, there's always pet instructions on there on when they can be back on the yard.
I ran into it. My neighbor had their yard treated, and I didn't realize it, and my dog went in their yard and had a seizure from, because it was a recent application of weed killer. So I'm conscious of that, and everybody that's ever had anything happen to their animal, you know how upset we get, and we don't want it to be our fault. So please, we want our viewers to not have any sick animals for their own cause. We mentioned things around the house, and many people don't realize that lots of dogs and cats eat strings and yarn. Yes. And what does that do when it gets in the body?
Strings are awful. You'll see now, like it used to be cat toys were almost always a string with something on the end. I mean, you used to see a lot of strings. They're getting better about it now, but strings, rope, sometimes if you get a t-shirt or something torn up where it becomes a bigger string or a rope, they cause what we call a linear foreign body. And what happens is it'll get in the intestines, and instead of moving through, they'll sort of bunch around it, kind of like a draw cord and like a pair of sweatpants where you can tie it. So they'll bunch up on top of the string, and the string can cut into the intestinal wall. It can cause a perforation in the intestine. It causes a real disaster in there. And when surgery is your only option to get it out. And sometimes you'll end up losing a big segment of intestines. It can be really bad. It can potentially be fatal if it goes on long enough. Wow. It's pretty nasty. The other thing is that falls into that category is tinsel on a Christmas tree. Yeah. Because cats love playing in a Christmas tree.
It's bright and shiny.
It's bright, shiny. It's about that long, and it's like the perfect thing that can.
So you eat a piece of aluminum foil and expecting it to digest. It's not going to digest.
No. Yeah.
Or it's going to stay in the body. Yeah. And the cat and dog intestines are like human intestines. There are feet of them or inches of them that just go on, and it's quite a extensive surgery to have your colon open
up. And if you lose a foot of it or more, which can happen, it can be life-altering for sure.
Sure, and if you don't know it in time, you can abscess.
Strings are a no-no. I mean, just in general, I wouldn't let them chew on or play with strings.
Or a ball of string, or
Or if they start pulling up the carpet, those fibers go on forever too. So those are another thing that.
Yeah, I've seen that a Berber carpet. You can just rip a whole string off. So watch that. You talked a little bit about foods. You mentioned grapes and raisins are not good for animals, and I think we've all heard some of the warnings about xylitol sweetener in certain varieties of peanut butter.
Yes, xylitol is an artificial sweetener, and how it works is when it stimulates the pancreas in a dog or a cat, you get something like 40 times the amount of insulin response as you would get from an equal amount of sugar. So you get this huge amount of insulin being released, which causes all the glucose in the body to go into cells. So the glucose circulating in the blood just goes way down. And so you'll see with lower doses, you'll see a drop in blood sugar. With higher doses, it can cause liver issues. And it's just an artificial sweetener that's in chewing gum.
I've heard it was in some peanut butters.
Yeah, it is in some peanut butters, and it's also, you can find it in I think there's been in some bread. I mean, it shows up in weird places.
So be careful. Just be careful about people food in general.
Yeah,
or especially peanut butter, because dogs like peanut butter in Kongs. If you're going to use it in a Kong and let them lick on it, for enrichment or whatever, or give them medicine.
Right.
I've given medicine with peanut butter. Just be careful that it is coffee. Don't let them drink coffee or eat coffee beans.
Yeah.
We talked about chocolate.
Yeah.
Milk. Don't we give the kitty a bowl of milk? No.
So milk is more of a...
What is the problem with milk? I've heard
just intestinal upset. I wouldn't necessarily call it a toxin. I think it's more of just GI upset. So it agrees with some of them and
doesn't agree with some of them. Okay. Raisins, you mentioned. Now, if your dog consumes any of these foods and you know they have,
right,
what should you do?
Give us a call, or another option that you've got if you're really concerned about it is the ASPCA poison control. There's a charge with that, but it's very much worth it, because they will tell you they've got a big enough database and they've got veterinarians there 24/7.
Great.
They can tell you if what you've eaten is a problem or not.
Okay.
And we'll use them pretty frequently, because a lot of times it lets us do only what we need to do, rather than just, okay, this might be a problem, might not be a problem, let's err on the side of caution. Right. They can actually tell you where that is. So there's a $65 fee, but if your dog got into your medications, it's not a bad idea to go ahead and get a case number while you're on your way into the hospital.
Right.
But we answer the phone, we're there. So if you have any questions, you can definitely call us and we can help. Sometimes we may instruct you to call the poison control. Sometimes we may tell you to come straight in.
And if your dog sustains an injury or ingests a poison or has trouble breathing, and you're headed to your vet's not open, and you've decided, either called, or it's best to call and say, I'm bringing in this kind of dog, and I think this is what happened. I'll be there in 15 minutes.
Yeah.
So that helps you, and then you can tell them, keep them quiet, don't give them any meds.
Yeah.
Bring along anything that they might be on currently, and head to BluePearl. So when they get there, they expect to see somebody like you, that's an emergency doctor that assesses the patient similar to a person has in the ER.
Exactly.
Let's see what's wrong. Let's check your vitals, that kind of thing.
You start out with a technician who checks the vitals and gets the history, and depending on how busy it is, our wait times usually aren't that long, but depending on what's going on, we have to take this, we triage, we take the sickest ones first. So if, you can't breathe or you're actively dying, you're going to go ahead of, something that can wait a few minutes. But for the most part, everybody really understands that, and it's not usually really long waits, because everybody's pretty efficient about getting patients taken care of.
Now you have a staff of, I think I counted on your website, about 18 vets that cover a lot of different fields. You yourself in emergency medicine, and then you have internal medicine specialists and other specialists that can be referred for an office visit for a problem a dog or cat might have, or they might be involved in the emergency. So just let's go through the different specialties that you have there. What would we start with?
So surgery, we have 2 surgeons. They're on call 24/7. They are available if we have something that needs surgery in the middle of the night, a dog that can't walk that needs back surgery, or cat that eats the tinsel off the Christmas tree and we find a linear foreign body. They can come in at any point. There's 2 of them, so they just alternate call. As far as on the referral side, they're there for any soft tissue or orthopedic procedure that needs to be done. The primary vets in the community will call if there's a case that they feel like they would rather our surgeons handle than them, and they can talk to our doctors and then send you over. They'll get you an appointment set up, but it's not.
And our shelter has a relationship with you.
Yeah.
Our veterinarian is only there during the daytime, and so anytime our officers come across a real emergency, outside of hours,
we know them all really well.
We know all our officers real well, and that's our go-to place. Because that's our emergency care for animals in this county. So you have the surgeons, and then you have internal medicine doctors. What do they do?
So they take care of it's sort of chronic long-term problems. Diabetes, Cushing's disease, Addison's disease, some liver issues, long-term kidney issues. It's more the metabolic things. They'll do endoscopy to get biopsies of intestines or the stomach, or look and see what's going on in there. If you've got like a dog that's had chronic diarrhea for forever and you just want to get to the bottom of it because you can't take cleaning it up anymore, or vomiting that's been going on for some time. But they'll also we're getting hemodialysis this fall, which is really exciting because there's not, I'm not sure if Knoxville has it or not, but usually the closest place to get dialysis, I believe it's Auburn or it's in Chicago.
So pets can go on dialysis treatments regularly just like humans can.
Yeah, and for long-term kidney disease, that makes a lot of sense. It's also useful in some toxins because you can, instead of doing the normal filter, you can put a charcoal filter in there. So things like Advil, if your dog eats their entire bottle of Rimadyl, or antifreeze even, it's a way to, it's at least some treatment options, which is really, and for, the patients that it's appropriate for, it can be really helpful. But that's really exciting. We're getting that starting this fall, hopefully. And then the other thing new that we're doing is tracheal stenting. We've been doing that for 2 years with really good results for dogs that have a collapsing trachea, so their airways closed down within their chest and they can't breathe very well. And it used to be a surgical procedure, but most of them weren't surgical candidates. And now we've got an option of putting the stent in there to open the airway. And for dogs that if they're appropriate candidates for it, we've had really great results with it.
Is that a breed specific thing or a size of animal?
It's typically small dogs. Pomeranians and Yorkies tend to be the number 2 on there. I think Chihuahuas, it happens fairly frequently, and Schnauzers maybe, but it's...
Wow, that's interesting. And to think that it's right there under our noses. These are places, these are chronic long-term problems that our own veterinarians might refer us to your clinic for. And many of those are done by appointment. And on treatment, it's like having a second veterinarian that treats this illness or this specific problem with my pet.
And they'll call and make a referral, set you up an appointment. But if it's something that can't wait, you can come in through the emergency department and get emergency stabilization until we can get you to that specialist. And
you call it the hospital. And it's a series of kennels that you have overnight guests in who need to be monitored. So it's like a little ICU, is it not?
It is.
Okay. And how would a pet stay there till it's stabilized or till it's completely recovered, or what's the usual?
They're as long as they need to be there. Sometimes they're there overnight, sometimes a week or more. It really just depends.
Depending on the animal. There's another subspecialty, dermatology, which I think a lot of us with our dogs and cats think, they have allergies. So we've been told they have allergies.
Right.
And I did not know this, but I was reading that many times dogs, the allergens go through their skin and not their respiratory system like people.
Yeah, and it's kind of any contact to it can be an issue. And I mean, the common ones, things in the environment, pollen is a big one, which is why there's so many allergy issues in Tennessee. Pollen, mold, fleas. Flea allergy dermatitis is really bad, and it's anything. You can have an allergy to anything you come in contact with. Those are the big ones.
And most of those are manifested how? Most pollen type allergies in animals. Do they sneeze? Do they have watery eyes? Or do they have skin itches? Or both?
It's both. It can be both, but the ones that we tend to notice the most are the skin issues and the itchiness. And our dermatologist does. He can do allergy testing on your dog, and also figure out what they're allergic to, so you can hopefully avoid it. And if it's not something you can avoid, they can come up with, based on what they're allergic to, basically a serum like you would at a human allergist.
Desensitize the animal.
Right.
And I was reading somewhere that, to have a dog that's likes to go outside and it's allergic to pollen or fleas or whatever. So there are certain things you can prevent through proper preventive treatment, like flea and tick bites. Flea, tick, and mosquito are all combined. If you consult with your veterinarian, you can prevent that part. But pollen you can't prevent. Another specialty I want to get to before we run out of time is oncology, because many animals do get a form of cancer of some kind.
Absolutely.
What's the most common thing for oncologists to do at your office?
So our oncologists, cancer, it's just like people. It happens. They're living longer, so cancer, I think, tends to happen as, we're doing a really good job on other diseases, so it ends up being that they'll get cancer as they get older. But even younger ones, dogs less than a year will sometimes get, even cats will get things as...
And they get skin cancers like melanomas?
Pretty much everything.
They get tumors inside the internal organs?
Yeah, bone tumors.
Breast cancer in animals is common. That's amazing. And many of us see lumps and bumps on our dogs and cats, especially dogs, older dogs. And what the best thing to do is just ask your veterinarian.
Oh, yeah.
What do you think about this spot?
Right. Anything that's rapidly growing, if there's a change in, you know, the ones on the skin may not, the ones you can see, I mean, you can tell how big they're getting, but if they've got an internal one, you can't always tell what it's doing. So anything rapidly growing, if you've got appetite changes, weight loss, a lameness, because bone tumors can sometimes start out as a mild lameness. If there's anything you're concerned about, see your vet. And if they, a lot of times they can handle the treatment of whatever the cancer happens to be. But if it's something that they feel is beyond their scope or they just want a specialist input, they can give our oncologist a call, get you a referral over, and then they can do anything from, sometimes it's surgical removal, sometimes it's chemotherapy, immunotherapy, pain management. The chemo's a little, I mean, everyone hears chemotherapy and they think all your hair is going to fall off, you're going to be miserable. It's the same drugs, but the goal is quality of life, so the doses tend to be a little lower, and 80% of them have no complications. And
you actually, I saw your oncology treatment room, so
yeah,
it is very much like a hospital. And you have some high-tech equipment in there. Was that large machine I saw an MRI or CT?
There's a CT scan.
CT scanner for animals.
Right. And we have CT, we have radiology, our lab is in-house. We've got ultrasound on site and endoscopy on the emergency side of things. If your dog eats something sharp and pointy, it's in their stomach, we can have one of our internists come in and scope it out.
Well, I'm running out of time, and I really appreciate you telling us today everything that BluePearl has to offer, which is immediate emergency care, 365 days a year. And as a pet owner, I would learn where it is. If you know where Lowe's is, you're there. Lowe's in Cool Springs. Your address is on Mallory Lane.
3020 Mallory Lane.
Okay, and you're in the corner there where the Bonefish Grill is, that same strip of buildings. So get familiar with it in case people should be familiar. If they get in the middle of the night, there's an accident or a sick pet, you want to know where to go. When we all know where the hospital is for people, we ought to know where it is for our animals too. It sounds like you guys can handle most anything that comes through the door over there, and we appreciate you being there 365, and we're lucky to have a place like that in our county. And I appreciate you giving us so much great information today. I want to let our viewers know that we have a busy month of June. On Saturday, June 3rd, we'll have another Book Buddies orientation at our shelter where kids can learn to read to our cats in our reading room. And also on that same Saturday, June 3rd, we'll be at the Williamson County Library for the Build a Better World event with pet adoptions. On June 10th, we'll be in Nolensville at the Poochapalooza at the Nolensville Bark Park. And then on Friday, June 16th, a huge event in downtown Franklin, the Mars Better Cities for Pets kicks off their nationwide Pets Welcome Project in downtown Franklin, where if you come and walk one of our dogs for 10 minutes, Mars will give our shelter $100. So line that up for Friday night, June 16th. Come see the pop-up park that will be on the square in Franklin and enjoy Yappy Hour and dinner specials at all the participating restaurants and merchants that are participating in the program and trying to make Franklin a more pet-friendly place. And we'll continue that on Saturday morning, June 17th. You can come see the pop-up park. And our June rabies and microchip event at the shelter will be the last Saturday in June, the 24th. And also on that night, we will have an event at Mill Creek Brewing in Nolensville on their new pet-friendly patio, Saturday, June the 24th. I want to thank Martha Bennett. I have a friend named Heather Bennett, so I knew I would do that. I want to thank Dr. Martha Bennett from BluePearl, and I want you to remember that BluePearl is always here for your pet if you have an emergency. And I hope you learned something today about what an emergency is and how to handle it. And I hope to see you next time on Pet Watch.
If I conferred with our furry friends, man to animal, think of the amazing repartee. If I could walk with the animals, talk with the animals, grunt and squeak and squawk with the animals, and they could talk to me.
I'm good.
I'm good.
I'm good.
I'm good.
But I have a story, and I don't know where to start.
I feel alone in a crowd.
I can't sleep.
I feel overwhelmed.
I don't even know who I am anymore.
I still have nightmares.
I can't live like this anymore.
I'm really not so good. But are you ready to listen?